Hi and welcome to our telehealth video information series. I'm Garvin and this video is on codeine phosphate. So what is codeine phosphate? Codeine phosphate is often just known as codeine and is prescribed for relieving mild to moderate pain in adults over 18 years of age, also for relieving dry, irritating, unproductive or painful coughs in adults and adolescents over 18 years of age. It's also used for treating acute diarrhoea in adults and adolescents, again, over 12 years of age. It's also used for the short-term relief of acute moderate pain in adolescents from 12 to 18 years when other painkillers such as paracetamol and ibuprofen have not been effective. So how does codeine phosphate work? Codeine is a type of medicine called an opioid analgesic, and is used in treating pain. Codeine works by mimicking the action of natural pain-reducing chemicals called endorphins that are produced in the brain and spinal cord. Codeine acts on the same opioid receptors as natural endorphins, and this blocks the transmission of pain signals sent by the nerves to the brain. This means that even though the cause of the pain may remain, less pain is actually felt. In treating cough, codeine works by reducing the nerve signals sent from the part of the brain called the coughing center to the muscles that produce coughing. Coughing is a reflex response to irritation of the airways and is usually helpful for clearing mucus, dust and other particles from the throat and lungs. However, sometimes coughing can become overstimulated even when there is no mucus to clear from the lungs or throat. In this situation, coughing serves no purpose and can become painful and frustrating. Codeine can be used to block the cough reflex in situations where the cough serves no purpose, so when there's no phlegm being coughed up. In treating diarrhoea, codeine works by acting on opioid receptors that are found in the muscles lining the walls of the intestines. This slows down the muscular contraction of the intestine. It reduces the speed at which the gut contents are pushed through the intestines, allowing more time for water and electrolytes to be reabsorbed from the gut contents back into the body. This results in firmer stools that are passed less frequently and so controls diarrhoea. So how do you take codeine phosphate? Codeine phosphate tablets and liquid or drops can be taken either with or without food. If you forget to take a dose of codeine phosphate, just leave out the missed dose. Do not take a double dose to make up for nearly a missed dose. For adolescents aged 12 to 18, should not take codeine more often than every 6 hours or for longer than 3 days. If your symptoms persist despite taking codeine, get medical advice from your doctor or pharmacist. So important information about codeine phosphate. Codeine phosphate may cause drowsiness and dizziness. It may be an offence to drive while you are taking codeine phosphate, so do not drive if you think it affects your ability to drive safely. For example, if it makes you feel dizzy, sleepy, unable to concentrate or make decisions, or if you have blurred or double vision. Do not drink alcohol while taking codeine phosphate, as it is likely to make any drowsiness or dizziness worse, and do not exceed the prescribed dose of codeine, or take it more frequently or for longer periods than prescribed by a doctor. Taking codeine regularly for a long time can lead to addiction, which might cause you to feel restless and irritable when you stop taking the medicine. Taking a painkiller for a headache too often or for too long can actually make the headaches worse. You shouldn't take codeine phosphate. So who shouldn't? So children under 12 years of age, adolescents aged 12 to 18, who have had surgery to remove their tonsils or adenoids for obstructive sleep apnea, and people who are known to have genetic variation of a liver enzyme called CYP2D6, which metabolizes codeine into morphine, people with very shallow, slow breathing, and people with chronic obstructive pulmonary disease or COPD, and people having an asthma attack, people with liver failure, and people who have blockage in their gut or who are at risk of this. Also not to be taken by people who have had a head injury or raised pressure inside the skull, and women who are breastfeeding. So can you take codeine while pregnant or breastfeeding. The safety of codeine for use during pregnancy has not been established. If codeine is used regularly in the third trimester, it may cause withdrawal symptoms in the baby after birth. If used during labour, it may cause breathing difficulties in the baby after birth. It should be avoided during pregnancy and the late stages of labour unless considered essential by a doctor, and then only if the expected benefit to the mother outweighs the risk to the baby. Codeine passes into breast milk in amounts that are probably too small to be harmful in most people. However, because some people metabolize codeine in a slightly different way, that can increase the risk of getting side effects from the medicine. It is recommended that women who are breastfeeding do not take codeine. So what are the possible side effects of codeine phosphate? So it'd be constipation, nausea and vomiting, dizziness or spinning sensation, drowsiness, confusion and headache, an itching or nettle rash, slow shallow breathing and decreased blood pressure, and difficulty passing urine, dry mouth, and dependence on the medicine if it's used for long periods of time. So can you take codeine phosphate with other medicines? You shouldn't take codeine phosphate if you've taken a type of a medicine called a monoamine oxidase inhibitor in the last 14 days. So MAOIs include the antidepressants phenelzine and isocarboxide and maclobemide and the anti-Parkinson's medicine selegiline. You're more likely to feel drowsy if you take codeine phosphate with other medicines that cause drowsiness, such as antipsychotics such as haloperidol and chlorpromazine, and the benzodiazepines such as temazepam and diazepam, and sedating antihistamines such as Piriton, and sleeping tablets such as Zimovane, and other strong opioid painkillers such as dihydrocodeine, morphine and tramadol, and tricyclic antidepressants such as amitriptyline. There is a risk of severe constipation if codeine is used with antimotility medicines for diarrhoea such as loperamide. As codeine can reduce the muscular activity in the gut, it may oppose the effect of the following medicines: domperidone, which is motilium, and metoclopramide. Codeine may be less effective if you're taking rifampicin or ritonavir. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through my website, mytelehealth.info, or call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.